I was having decreased range of motion or difficulty in touching my left toe, putting on a sock, buckling my shoe, and a physical therapist I was seeing for an elbow injury recommended, gee, you should get that checked out. And I just thought I was getting old. So I took her advice, and I wanted to see someone at Erlanger. So I looked in our directory to see who were our orthopedic specialists. And I selected Case Sanders, who at the time I didn't know anything about. I saw him in July of 2017. He did some x-rays and determined that I had multiple spurs in my hip, left hip joint area, and decreased joint space and basically arthritis and stuff from sports injuries, more than likely. He laid out several ideas of how we could approach this, from as minimal as taking anti-inflammatories to the next step of maybe an injection, steroid injection, to surgery, replacement of the hip. I realized after a year that I needed to go another route and have the surgery to replace my hip. So I scheduled to see Dr. Sanders again, and we talked about the surgery, scheduled it for November. I chose to have the anterior approach to hip replacement, which was, I feel, a great decision. I have a friend who had the same surgery the year prior to myself, and she was back to work in 4 weeks. I as well came back to work in 4 weeks. I probably could have done it in 2, quite honestly. But I decided to take the 4 weeks that I had already prepared to be away from work and thoroughly heal and rest. I had the surgery, and within 5 hours they had me up and walking. I was going down the hall carrying the walker. I really didn't need it. It was amazing, and all the physical therapists were flabbergasted and asking what I needed them for. Life now is great. I am pain-free and able to live life fully, having just returned from a snorkeling trip with no limitations. Although I work at Erlanger, I still had to do my research to determine which physician would be the best option for me and who I could really trust with that procedure. I'm so thankful that I met Dr. Sanders and proceeded with the surgery.